Advice isn't a set of instructions. It's more like a paint supply store. You give the seeker the colors and the canvas, it's up to them to make something of it, or ignore it altogether. Please note that any advice I give here should be taken with a grain of salt. Everyone's life is a different story, and these are merely generalized tips. Results will vary. The following was taken from the Mayo Clinic website and has little changes to it for readability. Antisocial personality disorder is a type of chronic mental disorder in which a person's way of thinking, perceiving situations, and relating to others are dysfunctional and destructive. People with antisocial personality disorder typically have no regard for right or wrong and often disregard the rights, wishes, and feelings of others. Those with antisocial personality disorder tend to antagonize, manipulate, or treat others either harshly or with callous indifference. They may often violate the law, landing in frequent trouble, yet they show no guilt or remorse. They may lie, behave violently or impulsively, and have problems with drug and alcohol use. These characteristics typically make people with antisocial personality disorder unable to fulfill responsibilities related to family, work, or school. Antisocial personality disorder symptoms include disregard for right or wrong, persistent lying or deceit to exploit others, using charm or wit to manipulate others for personal gain or for sheer personal pleasure, intense egocentrism, sense of superiority and exhibitionism, reoccurring difficulties with the law, repeatedly violating the rights of others by the use of intimidation, dishonesty, misrepresentation, child abuse or neglect, hostility, significant irritability, agitation, impulsiveness, aggression, or violence. Lack of empathy for others and lack of remorse about harming others. Unnecessary risk-taking or dangerous behaviors. Poor or abusive relationships, irresponsible co-worker behavior. Failure to learn from the negative consequences of behavior. Antisocial personality disorder symptoms may begin in childhood and fully evident for most people during their 20s and 30s. In children, cruelty to animals, bullying behavior, impulsivity, or expressions of anger, social isolation, and poor school performance may be early warning signs of the disorder. Although considered a lifelong disorder, some symptoms, particularly destructive and criminal behavior and the use of drug or alcohol, may decrease over time. It's not clear whether this decrease is a result of aging or an increased awareness of the consequences of antisocial behavior. Personality disorders are thought to be caused by a combination of genetic and environmental influences. Some people may have genes that make them vulnerable to developing antisocial personality disorder, and life situations may trigger its development. There may be a link between an early lack of empathy, understanding the perspectives and problems of others, including other children, and later onset of antisocial personality disorder. Identifying these personality problems early may help improve long-term outcomes. Risk factors. Although the precise cause of antisocial personality disorder isn't known, certain factors seem to increase the risk of development or triggering it, including diagnosis of childhood conduct disorder, family history of anti-personality disorder or other personality disorders, or mental illness, being subjugated to verbal, physical, or sexual abuse during childhood, unstoppable or chaotic family life during childhood, loss of parents through trauma, divorce during childhood, history of substance abuse in parents or other family members. Men are at a greater risk of having antisocial personality disorder than women are. Complications, consequences, and problems of anti-personality disorder include aggression leading to verbal or physical violence, gang participation, reckless behavior, risky sexual behavior, child abuse, alcohol or substance abuse, gambling problems, being in jail or prison, homicidal or suicidal behaviors, relationship difficulties, occasional periods of depression or anxiety, school and work problems, strained relationships with healthcare providers, low social and economic status, and homelessness. Premature death, usually as a result of violence. Tests and diagnosis. When doctors believe someone has antisocial personality disorder, they typically run a series of medical and psychological tests and exams to help determine a diagnosis. These evaluations generally include physical exam, lab tests. These may include a complete blood count, CBC, a thyroid function check, and screening for alcohol and drugs to determine if there are other causes for symptoms. Psychological evaluation. A person with antisocial personality disorder is unlikely to provide an accurate account of his or her signs and symptoms. Family and friends may be able to provide helpful information. Pinpointing the type of personality disorder. It's sometimes difficult to determine if symptoms point to antisocial personality disorder or another personality disorder because some symptoms overlap more than one disorder. A key factor in diagnosis is how the affected person relates to others. Someone with antisocial personality disorder is likely to have accurate, sometimes superior understanding of others' thinking with little awareness or regard for their feelings. This leads the person to act out and make other people miserable, with no feeling of remorse. Diagnosed criteria. To be diagnosed with antisocial personality disorder, a person must meet the symptom criteria in the Diagnostic Statistical Manual of Mental Disorders, DSM. This manual, published by the American Psychiatric Association, is used by mental health providers to diagnose mental illnesses and by insurance companies to reimburse for treatment. Symptom criteria regarded for a diagnosis of antisocial personality disorder include being at least 18 years old, having had symptoms of conduct disorder before age 15, which may include such acts as stealing, vandalism, violence, cruelty to animals, and bullying, repeatedly breaking the law, repeatedly conning or lying to others, being irritable and aggressive, repeatedly engaging in physical fights or assaults, feeling no remorse or justifying behavior after harming others, having no regard for the safety of self or others, acting impulsively and not planning ahead, being irresponsible and repeatedly failing to honor work or financial obligations, treatments and drugs. Antisocial personality disorder is very difficult to treat. People with this disorder may not even want treatment or think they need it, but people with antisocial personality disorder need treatment and close follow-up over the long term. People with antisocial personality disorder may also need treatment for other conditions such as depression, anxiety, or substance use disorders. Medical and mental health providers with experience treating antisocial personality disorder and commonly associated conditions are most likely to be helpful. The best treatment or combination of treatments depends on each person's particular situation and severity of symptoms. Psych. Psychotherapy may be provided in individual sessions, in group therapy, or in sessions that include family or even friends. There are no medications specifically approved by the Food and Drug Administration to treat antisocial personality disorder. However, several types of psychiatric medications may help with certain conditions sometimes associated with antisocial personality disorder or with symptoms such as aggression. These medications may include antipsychotic, antidepressant, or mood-stabilizing medications. They must be prescribed cautiously because some have the potential for misuse. Skills for family members. If you have a loved one with antisocial personality disorder, it's critical that you also get help for yourself. Mental health professionals with experience managing this condition can teach you skills to learn how to set barriers and help protect yourself from the aggression, violence, and anger common to antisocial personality disorder. They can also recommend strategies for coping. Ask the people on your loved one's treatment team for a referral. They may also be able to recommend support groups for families and friends affected by antisocial personality disorder. Prevention. There's no sure way to prevent antisocial personality disorder from developing in those at risk. Trying to identify those at risk, such as children living with neglect or abuse, and offering early intervention may help. Getting appropriate treatment early and sticking with it for the long term may prevent symptoms from worsening. Because antisocial behavior is thought to have its roots in childhood, parents, teachers, and pediatricians may be able to spot early warning signs, while diagnosis of anti-personality disorder generally isn't done before age 18. Children at risk may have symptoms of conduct disorder, especially behavior that involves violence or aggression towards others, such as bullying, conflict with peers, family members, and authority figures, stealing, cruelty to people and animals, fire starting and vandalism, use of weapons, sexual assault, repeated lying, problem behaviors in school, and poor academic performance, gang involvement, running away from home. Early, effective, and appropriate discipline lessons in behavioral skills, family therapy, and psychotherapy may help reduce the chance that at-risk children go on to become adults with antisocial personality disorder. Seeking help is not a life sentence. Once you can manage your disorder, it can no longer rule your life. If you would like to ask me for advice, please email or Facebook me. My links are in the description. I know you can pick any YouTuber to watch, so I just want to thank you for picking one of my videos. I hope it helped.